Hi there, my name is Richard Finn, and I'm getting ready to teach a class in trigger point therapy. I thought it might be a good idea to introduce myself with this video and let you know why it might be a really good idea to get somebody like me to be an instructor for your trigger point program. Basically, I've been treating trigger points as a separate discipline since 1989 when I graduated from the Academy for Myotherapy and Physical Fitness. That's a lot of time practicing. I additionally had a background as a physical therapy specialist in the Army Reserve and many years working in chiropractic offices. So I fused this trigger point therapy with that underlying information that I had some experience with. Then, while I was studying, the first thing I read was Pain Erasure. I read this in 1984 when I was in the military at the Academy for Myotherapy, while I was in the Army at Fort Sam Houston studying to be a physical therapy specialist. And based on that information, I began treating trigger points in this physical therapy setting. And then when I got done with my training in a chiropractic setting, then I learned that there was another school specific for trigger point therapy. So I did an entire trigger point therapy protocol training in 1989. So again, that's my background, doing trigger point therapy as a specific discipline, not as an add-on to something else, but as a specific discipline. Now, as a result of doing that, I ended up teaching in a school. It was called the Academy for Myofascial Trigger Point Therapy initially, and then it became the Pittsburgh School of Pain Management, where we used the 2-volume set, Myofascial Pain and Dysfunction, by Dr. Travell and Simon, who, again, that's the specific text that was created for trigger point therapy, and we would read through those every year from cover to cover. So again, that's a lot of background. Now, what differentiates trigger point therapy as a discipline? I think this is really important to understand as we understand the underlying fundamentals of trigger point therapy, and we'll be talking about those in the class. But then, in order to figure out where to work, we look at the pain pattern, we look at the dermatome, and we evaluate muscle length using specific tests. And again, I've put those tests together in a wall chart so that people can see that and learn how to do that on their own. And then we do gentle compression techniques. Now, the beauty of doing gentle compression techniques is nobody does gentle techniques. When you say trigger point, people put in elbows and they press really hard and it hurts. Now, some people like that pain. I'm going to emphasize very gentle techniques that are gentle on the patient, but also they need something to be gentle on us. We don't need to be hurting ourselves while we treat people. And that is huge. So I hope that you'll be able to look into that. Now, the other thing we do after we use gentle pressure is Dr. Travell always emphasized that we needed to do movement following the treatment. So there is always a movement or stretch type of component that goes along with doing trigger point therapy as a discipline. And this is something that can be demonstrated for patients or clients. And again, they can be encouraged to do things like that to maintain the benefits of their treatment. So this is a huge different approach. Again, we're looking at this as a discipline, not as an add-on to what we're already doing, although it can be used that way. But we're going to look at how do we do range of motion testing, how do we evaluate some aspects of the nervous system for our work, and how do we apply the treatment gently and humanely, I would add, in order to get the best results. So I really hope that I might see you there at this seminar. Thanks for listening. Goodbye.